What's up, business heroes? Open enrollment is now. If you are shopping for health insurance, December 15th is the first cutoff uh, to enroll in a health insurance plan if you want that to go into effect starting January 1st. Now, don't worry. I mean, that's just a few days away, but don't worry if you're not ready to choose an option. You need a little bit more time. You got it. January 15th is the deadline to get health insurance. That won't start until February 1st though. But this is called open enrollment. Every year there is a window from November 1st to that January 15th deadline when you can shop for a new health insurance plan. Doesn't matter what the circumstances. There are other qualifying life events that make you eligible to go into the marketplace and buy a health insurance plan. For instance, if you get married, or if you have a baby, or if you have a change in your career, maybe you had health insurance through an employer, but that's changing up and you don't have health insurance anymore, you can apply for a qualifying life event and go into the marketplace and get some health insurance anytime during the year. Um, so that's the context for what we're talking about today. Quick disclaimer, I am not a doctor. I am not a health insurance broker. I'm just a helpful guy who has gone through this process a few times. I've explored different options and I know how daunting it is. This is honestly one of the things that really held me back from jumping into full time self employment sooner than I did because I had a job that provided benefits, and one of the biggest ones, or so I thought, was health insurance, and I was scared to death of losing that and what that meant, especially having a family that was being insured through this plan that I had through work. Um, my employer was really generous. They were very flexible. They worked with me. I was actually able to step down my work schedule a little bit to 4 days a week. So I had some extra time to build my business. But if I went down any lower than that, it was like if I went less than 30 hours, different companies might have different policies, but they wouldn't offer health insurance anymore. So I just kind of like hung out in semi self employment limbo for about a year before I finally pulled the trigger, and it was the health insurance that really held me up. So, I invite you to share any questions that you might have. You can drop them in the chat, leave a comment, and I will do my best to speak to that. Again, I am not the smartest person in the room when it comes to all the details and nitty grittiness of health insurance, but I'm going to spend the next few minutes just sharing my own experience walking through this, how I navigated it, some of the options I explored, what I signed up for, what I ended up changing to, and where I'm at now with it. So, um, let's dig in. It's not that complicated. That's another thing. Like, where do you even start? I think one of the best places to start is to understand the different options you have available. One of the biggest ones that you'll hear about is the marketplace or the exchange, healthcare.gov, or sometimes states have their own exchange. I live in Pennsylvania, so Penny, Pennie, is the cutesy name that they came up with for our health insurance exchange. I'll bring that up here. You can take a look. Um, you can also go to healthcare.gov if you don't know the name of your state's insurance plan. They might not even have their own exchange. You can just go to healthcare.gov and you can start an application. And then when you choose your state, let's pretend that we're in Illinois. I don't want to log in, but maybe some states have their own marketplaces. See, usually, last time I was here, like, let's say if I was in Pennsylvania, aha, you live in Pennsylvania, you'll use the Penny website to enroll in health coverage. Okay, so Illinois, I guess, just uses healthcare.gov and you log in directly there. Otherwise, let's check out California. They direct you to covered California. So you can start at healthcare.gov and they will tell you if there's someplace else that you should be going if you need to go to your state's specific exchange. But before we dig further into this, let's talk about some of the other options that are available. So there's the marketplace plans, there's private insurance. Um, you can buy insurance directly with a company. That's usually not the cheapest option. Another option that you will hear about that is really it's expensive. There's a use case for it, but Cobra, I forget what it stands for. It has nothing to do with snakes. It barely has anything to do with health insurance, but Cobra is the little provision that allows you to continue your employer's health insurance plan, um, but you have to pay like more than 100%. You have to pay the full amount of the health insurance and then some, but I guess it's helpful as a stopgap solution, especially if you have an ongoing health issue that you cannot go uncovered. Like that's just too risky. Might be worth paying into Cobra until you can figure out another option. But I would just recommend going and trying to figure out the other option because that can get really expensive really fast. And then there's also alternative non-health insurance options like health share ministries, um, and well, what was the other thing? There's actually a new telehealth is becoming pretty popular, and there's different services that kind of wrap around telehealth and offer uh, a little bit more. Just recently, through Freelancers Union has been advertising a partnership with Galileo. So if you just check out this, I mean, they highlight Galileo is not an insurance product, but if we check this out, they pitch it as unlimited medical care starting from $229 a year. That sounds great. Um, but really it's kind of access to a doctor. It You could get kind of simple primary care advice. Um, they say Galileo treats everything from common cold to diabetes. No matter your concern, we've got you covered. You have prescription savings, access to dental and vision. So it's a compelling thing to look at, but I do not believe it will cover something like an emergency room stay. We can take a deeper look at this a little bit later in the stream to see what this is all about. But that's just another option that's available. And I expect to see more services like Galileo that kind of wrap around some sort of telehealth service and market it and make it look fun and funky. And let's get some healthcare, everybody. Um, and it really kind of through Freelancers Union, it's kind of positioning itself to be a resource for people in the gig economy, people who are freelancers. um, One of the original alternative health insurance, or not health insurance but healthcare coverage solutions, were Christian Health Share Ministries. um, I don't know the whole history of it, but I imagine it was probably designed for people who are in ministry, people who are pastors, people who are not traditionally employed by a large company that would be able to offer group health insurance rates, but rather it's a group of like-minded individuals. Usually they're Christian. There's usually kind of like you need to subscribe to a certain faith or worldview, I don't know if there's alternatives for different religions. Most of what I've seen have been Christian, although I have seen non-religious, non-faith-based health share communities. But it's one version of it is just a pool of people who pay in, and it's basically their own mini insurance. Um, and there's a pot of money that you can request to get paid out of to help cover expenses. Typically, though, it's just for emergency stuff. So to kind of help offset some catastrophic, healthcare expense. If uh, if you're looking for prescription coverage or primary care, it usually doesn't cover that. But I'll talk about my experience with that in just a second. So that's a rundown. Marketplace, private alternatives like health share ministries, telehealth services, and then there's also, let's not forget about government subsidized programs like Medicaid and CHIP. That's free or low cost insurance for kids. Those are programs that you can apply for that can really help lighten the burden, lighten the expense of health insurance. Um, when I finally pulled the trigger, now this is my experience. Um, I was fortunate enough to have learned about CHIP and state insurance. Actually, two of my kids were in an early intervention for different things. One had a speech delay, so we had them enrolled with early intervention, which is a state program. And as soon as you did that, they were eligible for state insurance. I don't think this is even technically CHIP, but it's like CHIP adjacent. Um, and another kid had an early intervention as well. So two of our three boys are actually covered currently by state insurance, which is a huge blessing. Um, we'd be able to figure out another way if that wasn't the case. But I'm not going to pretend that we do not greatly benefit from that program, which was made available to us. And then our third child, who didn't go through earlier intervention, we enrolled him in CHIP. Now, CHIP is anybody can apply. It's there really isn't a income uh, maximum or anything, but the benefit will kind of change based on your income level. Is a little bit of a pain to apply each year. Shout out to my wife who does all the paperwork and helps take care of that. But it's worth it. Spend a little bit of time online filling out that application. It's mostly straightforward, and it, I think, saves you a lot of money in the long run on health insurance because now I just need to shop for a plan for me and my wife. The less people that you have to pay for health insurance, the better. Um, so definitely check out CHIP. I think if you are a parent, that is kind of your first line of defense, just to see what are we dealing with, like how much insurance, how many people do we need to insure, um, just to kind of establish a baseline, and then you can go start shopping around now that you know what you're dealing with. So after our kids were in chip, now I need to figure out what am I going to do for me and Susie. And I was looking at different things, and healthcare.org again was a good starting point. And I was looking at plans there, but here's the thing that put me off from that. You can apply for a tax credit, a subsidy, that brings your premium down. That tax credit is based on your income. And if you're a freelancer, if you're not getting paid a regular salary from an employer, but you are generating your own revenue based on the projects you're able to secure throughout the year, my income, I might have a okay year. I might not have a great year. I might have a fantastic year. So I was really scared if I was going to sign up for health insurance and I was trying to calculate the cost of that based on a certain income level, but then I ended up making more money than I was expecting to. What then? Um, Also, I'm sorry, guys. This looks flipped. Can you see? Let me. Do I need to do something here in the settings to flip this? It looks flipped to me. I hope it's not flipped to you. Otherwise, it's going to be really annoying. Anywho, moving on. So that was the thing that freaked me out about the healthcare.gov, the marketplace. I didn't want to be in a position where, I think I'm paying $200 a month for health insurance, and then I take on a project that bumps my income, over the threshold for that subsidy, and now I'm on the hook to pay a lot more. Like that tax credit disappears, and I end up having to pay the full amount um, at the end of the year. Now, there's a way to mitigate that. And also, if you're making that income, that's money that you have to help cover that cost. But I'm a planner, at least when it comes to finances. Most everything else, not so much. But that was just a big variable that I wasn't comfortable with. So I started looking around at other options. I kind of put uh, the marketplace option to bed, and somebody was telling me about um, Health Share Ministries, and I decided to take a look at it. I wasn't really sold on it. It sounded uh, weird, honestly. Like I like things to be a little bit more conventional, and I'll tell you one of the things that I kind of ran into. Anyways, I called up one of the popular companies, I believe it's Christian Health Share Ministries, and I was talking to an agent there, just trying to learn a little bit more about it. And they actually told me about an offering that is a lot more like conventional health insurance. Because I was kind of like, oh, if I just do like a wellness visit, especially for my kids, not that I really need to worry about them because of Chip, uh, but just kind of preventative care, prescriptions, stuff like that. Those aren't typically covered by that. It was more for just emergencies. I was like, well, that's not what I'm really interested in. Like, I want to be able to go to the doctor for a checkup, right? And not have to pay out of pocket for that. Which, quick side note, paying out of pocket for a doctor's visit isn't a bad idea, depending on your other options. Because if you are willing and able to pay cash for a doctor's visit, they'll usually give you a discounted rate. They like it when people can show up and just give them money and not have to submit a claim to the insurance company and wait forever and a day for that to get processed and that payment to finally hit their account. If you can say, I can pay cash right now, how much does it cost? They'll usually cut you a deal. A friend of mine, uh, it was crazy. Really, all you have to do is ask. Long story short, he his wife had a baby, and he got hit with the bill, and he was just trying to figure out, like, man, like, how am I going to pay this? And he was asking, is there any sort of like discount available? And they said, oh yeah, if you like pay up front or something, you don't like jump through all these insurance hoops, and then like they gave him like a 30% discount, which saved him like thousands of dollars on it. um Not going to debate the cost of health services during this stream, um, but that was something that saved ended up saving him a lot of money. So just ask if there's a discount available. It never hurts. Also, if you choose to go uninsured, it's risky, especially if you end up getting like something that requires some intensive treatments. You end up in the emergency room. It's risky. You can still try to go for those discounts, but if you're relatively healthy and you're just planning on hopping in the doctor once a year for a checkup, or uh, you know, you you got bronchitis and you want some antibiotics or antiviral, whatever you need for bronchitis. Again, I'm not a doctor. Um, it's going to be a lot less expensive to just pay for the doctor's visit than to pay for like premiums over the year to then go to the doctor's visit, if that makes sense. Back from our little side note, I was talking with the Christian Health Share Ministry representative, and they told me about another service, which was a lot more, resembled a lot more traditional insurance. They were very clear that it wasn't insurance. It was called UHSM, Unite Unite Health Share Ministries. Now, back then, it looked different. Uh, if you can see this, we have they're advertising We Share programs. So I don't know if they've changed things up, because before they had bronze, silver, gold, platinum plans like you'd expect to see in a regular health insurance plan, and they had their price charts. But instead of saying deductibles, they it was a health share payment or something. They just kind of changed up the nomenclature of what they called it, but looking at the pricing tables is basically what I was familiar with, making health insurance selections back at my job. And it was relatively affordable. The thing that was weird though was, they participated, I guess. There's UHSM, and I had a UHSM card. We did this for about a year or two, and but they were a part of like an Aetna First Health network, which is a large network. But it was never quite clear when you're shopping around and asking if the doctor, or service provider accepts your insurance, and they're saying like, "Oh, what's your insurance?" You weren't supposed to say UHSM, you're supposed to say Aetna or whatever. They ended up changing that network to PHCS, and let's see if they actually have some information here about that. Um, yeah, they definitely changed this up. Comprehensive program versus catastrophic program. If I had to imagine what's going on here, it's been a while since I've checked. Uh, um, Spoiler alert: I ended up changing my plan to something else, but now they're advertising a comprehensive program. This might be what I was on. Not entirely sure. Compare programs. There, I don't see the metal tier stuff anymore. But here is, well, here's something to look at. I'll leave links to all of this below. Like, it's an affordable alternative if you're just, kind of weird about going into the conventional insurance marketplace. And it was fine. Like, we didn't have any major health issues, praise God. Um, but I also, it was kind of like a little complicated to figure out, who would accept this insurance. Um, at the end of the day, we were fine, but especially since they switched over to PHCS PPO, I think is their network now. I don't know that we just were having issues trying to find people to cover that. But maybe depending on where you live, that might be a lot easier to find somebody who accepts that. But we did that for a year. It was fine. We ended up paying a little bit less, or about the same as what I was paying, for premiums, after my employer made a contribution to it. So, out of pocket, we weren't hurting at all. So that's kind of like where we landed on. After doing this for a year, I started looking at the marketplace again, and something else to talk about, during COVID, they passed a, oh man, it was one of the acts. I forget if it was the Secure Act or something, but they basically approved expanding the subsidies, for the marketplace plans. Um, Normally, your income, like there is this cap, and it was called the subsidy cliff. Like if you made $75,000, just as an example, I don't think this is accurate, but if you made $75,000 household income, you'd be eligible for a subsidy. It'd be on the lower end. You wouldn't have as much savings as if you had lower income. But then if you made like $76,000, maybe you got a bonus, or, somebody paid you some money, you mowed somebody's lawn, or you get some bonus income that puts you over that threshold. The subsidy doesn't like gradually decline, it just disappears completely. That's how it used to work. And that was another thing that really freaked me out. In addition to the variable nature of the cost, just really like fearing that you would lose all discounts altogether, that cost gets skyrocket really fast. I actually have another video. I'll link to that in the description afterwards, that demonstrated how that worked. But the government actually did something useful, and they expanded that subsidy, so more people had access to it, and it wasn't as dramatic a cutoff when it happened. That was originally slated to expire, I think it was like 2023, but they extended that through 2025. So that was another thing. I was like, okay, I'm going to go back into this because now there's more savings for a wider range of household income levels. I feel a lot safer going into this. So I checked out um, the healthcare plan again, or sorry, healthcare.gov, Penny, Pennsylvania, um, and found a plan there, and we switched over. And that is what we are on to this day. Will that change in the future when the subsidy expires? If it expires, maybe. We'll get there. Um, and I will talk a little bit more about like how you can control that cost, like that variable nature. So the subsidy thing that was taken care of, that was nice. Have some more savings available, lowers the premium, the out of pocket cost of health insurance even more. Still freaked out by the variable nature, but then I figured out how to deal with that, to make that less of a daunting proposition. But I'll get to that in just a second. How about we take a look at some of these things so we can actually like get some numbers in front of this. Here's a couple really helpful tools. So you can just go straight to healthcare.gov or to your state exchange. Here's a peek at Penny. I went ahead, you can click savings calculator and start shopping for health insurance. Answer 3 questions, again, estimate for your savings. I already pre-populated this with some dummy data, and except that is my birthday, June 16th. Now you know. But let's say we have a family of 4 in Pennsylvania. Everybody's seeking coverage, and our annual tax household income is $80,000. Click here to see if we qualify. Oop, it expired. All right. Well, let's plug it in again. All right. So let's just. This is my real birthday, just in case you want to steal my identity, or send me birthday gifts. And here is a made up birthday for my wife, so you can't steal her identity. And let's pretend that we only have one child. I'm glad I have 3, but one would be a lot quieter. Let's say he was born June 20th, 2015. Now, let's just say household income is 80,000. See if we qualify for savings. Now, it bases your qualification, your eligibility for savings based on your household size. So this is going off of 3 people. And there's a table. They have numbers, they do research, and they calculate, okay, based on the poverty level for a family of a certain size. So a family of three, needs a lot more income to sustain than a family of one. A family of five needs even more. So, like, the larger your family, um, the more the poverty level lowers. Whatever. Let's just look at what this says. All right. So, household members, applicant, spouse, and child one qualify for lower monthly premium, estimated tax credit of $496 a month. Based on the income you entered, you may qualify for an advanced premium tax credit. A tax credit could lower your monthly insurance bill to $437 a month. So we can go into the marketplace now with that information. Or I could go back here and just let's see how this changes. Let's add my three kids. Let's just fudge birth date. Now we have a family of five on 80,000. And what do we have? Look at that. Our tax credit went up. I don't have the other number in front of me, but your monthly premium may be about $207 a month. It got cut in half. If you don't have this calculator available in your uh, health insurance exchange, you can go. Here's another tool. You don't need to log in or anything. It's from the Kaiser Family Foundation. Um, if you go to kff.org/interactive/subsidy calculator, I'll add a link afterwards. You can check out this health insurance marketplace calculator. It looks very similar. You select the state that you're in. Let's pretend you're in Connecticut. Well, no, let's just pretend I don't know Connecticut zip codes. Uh, so living in Philadelphia and here you go, yearly household income as dollars versus your percentage of the poverty line, if you're at it, or how far above it are you. I think you qualify for subsidies up to 400% of the poverty line. You'd still get some sort of tax credit back. So let's say 75,000. Is coverage available from your spouse's job? No. Number of people in your family? 4 this time. Number of adults? 2 adults. We're about this age. We do not smoke. I guess that increases the risk pool and will make things more expensive. And number of children, 20 and younger, enrolling 2. Age 7 and 6. And no, they don't smoke either. Gosh, that'd be sad. I hope there aren't 6-year-olds smoking cigarettes. And you are likely eligible for financial help. And here it says, based on the information you provide, your income is equal to 250% of the poverty level. This means you are likely eligible. So, yeah, it calculates your income as it relates to the federal poverty level. And there's just like a baseline. I don't know. I don't know how they determine that, but they've determined it. Um, and that is how they decide how much financial help you'll receive. So this family of 4 in Philadelphia would be receiving $891 a month as a premium tax credit. And that could get paid directly to the insurer. Um, so the government will pay that tax credit ahead of time, and then you are on the hook for that additional $250 a month. That is now your contribution, and they're basing this. Okay, and they also have things like, so the most you have to pay for a silver plan, we'll take a look at that in just a second, is 4% of income for the second lowest cost silver plan. Without financial help, your silver plan would cost over $1,100 a month. But now we're only paying $250. That is very nice. But this is the scary thing, right? $1,100 a month for insurance. If I am no longer eligible for that tax credit, I'm hosed. That's $13,000 a year. Jeepers. So how do we control this, and how do we ensure that we don't end up going over our limit and losing that subsidy and getting ourselves in a major, major pickle? Should we cover that now? Or do you want to go should we take a look at how you actually like what these plans look like? I'll bookmark that. We'll circle back around to controlling the cost, but there is a way. There is hope. We figured it out. Um, but first, let's actually now go a little bit further and go into the marketplace. And here's another thing. So back to Penny. I don't know if you see this here. Uh, this is the little report how much insurance may cost. Household members, child one, two, and three, qualify for coverage through CHIP. So actually, if I proceed, what did I plug in here as the 80,000? Even with 80,000, we qualify for savings. And when I click browse plans, now this is a nice thing when you actually go and start shopping for plans. You can search for a medical provider that you already have, uh, a doctor you use, or a service you need, or even prescriptions that you use. And you could see it will show you only the plans that work with the healthcare providers and prescription medications that you need, that you already use. So it filters that out. So let's just skip to view plans. And this is for 5 members in zip code. Oh, it didn't do it this time. Back when I was shopping for this, it actually kind of like kicked that out, saying like, "Hey, actually, just sign up your kids for CHIP. You're eligible for it." So this is showing for a family of 5, and ooh, even with what are we looking at? Expense estimate. This kind of shows us the price. That looks a lot higher. Things change. Expense estimate, monthly price. This is not what I am paying for. These are very expensive plans. This is going off of 5 members in zip code 19047. And this is why people are scared of the marketplace. Expense estimate. Usually this calculates the is this the price minus the subsidy? Let's edit the family info again. All right, so let's just say if we get our kids, okay, dude, guys, sign up for CHIP, fill out the paperwork. Even if you think you make too much money, you could still be eligible for low cost CHIP, and you can be paying like our oldest son. Like after my business started to grow, my income started going up. Originally, I think he was free, and revenue increased. I'm still paying not that much. I want to say like $30 a month for him. So let's say if all 3 of my boys had to be covered through CHIP, that's $130 a month. No, that's bad math. $90 a month, plus the cost of me and my wife. So let's go back. So if we remove them, so this is keep them on here. Don't remove them, but they're not seeking coverage because they're going to be covered through CHIP. Now let's browse plans, and hopefully this will be a lot more palatable. Actually, let's see if this kind of prompts us. Uh, Tell us about your healthcare needs. Oh, it has a little survey too, like doctor's visits per year, just 1 or 2 times. and there's different plans that cater to different health needs. We can talk about that in just a second when we look at the plans. Ongoing monthly prescriptions, just 0 to 1. There's like one or two. We can talk about, like, see if what prescriptions we have, what plans cover it. Now let's go. There we go. That's a little bit better. That's less than half of what we were originally looking at. So let's look at these different plans. When you're in the marketplace, you're going to see metal tiers: bronze, silver, and gold. I don't know if they're showing us, is there a platinum? Maybe not in the marketplace. Bronze plans are going to have a lower monthly premium, but it's going to be a higher deductible. So you pay less up front, but if you need to get, say, and you go to the emergency room, you're going to pay more out of pocket before insurance kicks in to cover the cost. If you go up to a silver or a gold tier, you're going to see your monthly premium increase. You're paying more per month, but insurance is going to kick in and cover the cost much quicker. So let's take a look and kind of compare this. So let's see. Uh, Everyday bronze, we have a $540 a month. There's a $40 copay for primary care visits. Here's the deductible. This is what you want to pay attention to. 1690. So you pay all expenses out of pocket until this amount is reached. Then your insurance company starts paying their share of the covered cost. Okay, so even though this is really important to understand, even though you are paying this much money every month, you're still going to need to pay this much money before insurance does anything, with a few exceptions. So if it's just a primary care visit, you don't need to pay out of pocket um, up to almost $17,000 before anything happens. You can pay a $40 copay instead of the full amount of the doctor's visit. Here's some more details. Some things that are covered in network. So, a specialist visit, if you're going to a dermatologist instead of your family doctor, that would be a $90 copay. And then they have some other things here: laboratory outpatient services. But then, if you want an x ray, it's 50% coinsurance after deductible. So, if you need to get an x ray, maybe you broke your arm, you're not sure, let's shoot a laser beam at it. You have to pay out of pocket for that until and then once you hit that $17,000 deductible, then insurance will pay for half of it. So is this a great plan? I don't know. Keystone, HMO bronze, higher copays, deductibles about the same. Let's look at a silver plan now, and we see the premium go up and the deductible went down. Let's find Independence. Deductible is 10,000. This one is a $724 monthly premium. $4,800 deductible. You pay all expenses out of pocket until this amount is reached. And then there's a separate drug deductible. So that's interesting. So different plans handle these things differently. And then there's this thing called OOP Max. That's out of pocket maximum. So that is the maximum amount of money that you are going to spend even after you reach your deductible. Some of these have a $50 co-insurance or 50% co-insurance, where insurance is still only paying half of what you need towards that service. Um, but you will only pay, say, if you just got it, like that one example, if you had like hundreds of x-rays, whatever, you have to pay half the cost of that x-ray after you hit your deductible, but you'll only be paying out of pocket up to $18,000, 900, $18,900. These are still really big numbers. And I'm curious because I got in, maybe I need to plug in my specific numbers. I got in on a plan much less than this. And I wonder what I'm missing and why these are up. And if this is showing me, this is the expense estimate. I'm sorry. I think I'm scaring you unnecessarily. Let's try this again. Let's go back to Penny. Let's get covered because these are expensive. Let's just plug in some numbers here. Oh, yeah. 19 is not a month. Okay. Uh, let's say just by happenstance, everybody is on the same birthday. Sorry, those numbers are really high. Like I'm paying $240 a month, not $700 a month for insurance. So I don't know why it's up there. It might just not be showing the premium applied. So let's fix this. I mentioned I'm not an expert, right? Qualify that. All right, I'm going to say not seeking coverage. I'm going to insure them through CHIP, and let's say 75, because I'll talk about how we can control your total income. See if you qualify for savings. All right, next. Now skip to view plans. There we go. Okay, so don't just skip to view plans because they're going to show you plans without applying the savings. This is much less scary. Don't be scared of health insurance. I was getting scared of health insurance. I'm like, oh dang, what I get? What, what happened here? So here we go. Our bronze plans now are free 99. Our silver plans are what much closer to what I'm paying, $218, $193, $220. Be still my heart. Okay, so now we're applying the estimated savings are showing us the tax credit applied to this. Poof. All right. I apologize. Doing it live. Didn't have this prepped and ready to go. So when you again, what I did there, what I did wrong was when I went in, I just clicked view plans instead of going through the little wizard that shows if you're eligible for savings. If you don't want a heart attack and have to pay a crazy $17,000 deductible, don't do what I did. Go through the wizard, see if you're eligible for savings, and it will take that estimate and apply that to here. Now we have a much more accurate view of what we have to spend. Holy moly. I bungled that up. Good. So here we go. Now we're only spending $218 a month for our health insurance plans. You can filter by a number of factors here, the company, the metal tier, CSR eligible. These are extra special discounts. Some, I guess these are kind of like preferred plans that they'll give you a little bit of extra savings. And HSA qualified, honestly, it's hard to find one that kind of makes sense. Most HSA qualified plans are going to be high deductible plans. But this one's interesting. Bronze HSA HMO. What's an HSA? It's a health savings account, which is a nice tax advantaged savings account where, say, all right, I gotta spend X amount of dollars for a premium, you could sock that away, and that can be like out of your revenue. That can lower your taxable income. You can put that into an HSA. I think up to $11,000. Don't quote me on that. There is a limit, but it's a like double or triple tax advantage account where you can lower your income, your taxable income, put that in a savings account, and then when you spend out of that savings account for a qualified health related expense like a doctor's visit, um, but it's pretty flexible. I mean, like I think you could buy diapers with it or band-aids. You could use your HSA and it's tax free when you do that. Um, or when you withdraw it, it's tax free. And here's the cool thing: you can invest your HSA in the stock market or investments as you choose. I use an HSA provider called Lively. Eligible for an HSA, you need the it's weird. Sorry, kind of going all over the place now, but you need an HSA eligible plan in order to have one. But I had an HSA eligible plan from my previous employer, and it goes with you. It's not a flexible spending account like Aflac, where you have to spend that every year. So you kind of upfront say, maybe I'll spend $500 in eligible expenses. I will pull that $500 uh, out. That's tax advantage. And I have to spend that. And if I don't spend it, I lose it. That's no good. An HSA, you don't lose and it goes with you. I own my HSA, even though I haven't been working at my old employer for several years now. And I still have funds in there. And it's accruing interest because I have most of those funds invested. Actually, it's losing a lot of money because the stock market has been tanking the last few years. But um, you can do that. And the interest, anyways, HSA are great. It as long as you spend it on eligible things like my I put $10,000 into an HSA. If over 30 years it quadruples or more, um, that's all tax free. I don't have to pay taxes on the gains as long as I use the HSA to buy healthcare stuff. Another side note: you guys tracking with me? I haven't received any specific questions, so I'm just kind of just free association health insurance facts at you, spitting some health insurance facts. Um, what else can we look at here? All right, so that's an HSA. We can figure out what sort of plan we want to enroll in, and then you add to. Now, when you go through and you actually buy your health insurance, they will. Um, there's like a little application process. I forget exactly everything that they asked me, but you need to verify your income. I think, I mean, they have access to your info, so don't try to cheat the system. I think I uploaded proof like a pay stub or a W-2 or a tax return would be another thing. Something that like kind of shows, all right, this is um, some verification of your income, and then you go and buy it. Then they pass you off to the health insurance company itself. I have a plan through Blue Cross Blue Shield or Independence. And so now I am dealing with them directly. Um, and when it came time to renew this year, somebody reached out, and I believe all I had to do was talk to Independence. Uh, I did receive an email, and I'm logging in, and I see that there was like a reapplication. I don't even remember what I did, so it's that simple. I think I just had to like reapply. There was no change in my financial situation, um, so I think you just have to like do a quick little like income verification, and then if you want to keep your plan, you're satisfied with it, um, you just renew it. I think you could do it online. I ended up calling somebody. It was painless. It was actually not a long wait time. This is my experience. Your results may vary. And I ended up actually saving a few bucks per month. Like the cost went down. So awesome. I'm just trying my best to. I'm saying a lot here. I'm spitting a lot of facts, going all over the place. But at the end of the day, I just want to assure you as much as I can that this is possible. It's approachable. You don't need to be scared of it. Please, please don't be scared of it so much that you are unwilling to take a chance on yourself and to step away from your employer and start something. Make sure you have stuff lined up. Don't start a business foolishly. Have reasonable expectations. And I can speak a lot more to just how to build a solid and conservative on ramp. So you're not just jumping into the void and hoping that your business idea catches you before you hit rock bottom. Like there's a way to build a solid foundation for business growth while you're still employed and receiving benefits from your employer. And then you make the jump. But when you're ready and you want to, it's not for everybody, but make the jump. Don't let health insurance be the thing that holds you back. Um, it almost held me back. It held me back for an extra year. And you know what? God is good. His timing is perfect. I'm a cautious person. It played out the way it was supposed to play out. But now I'm very confident. I feel good about what I'm doing. And real quick, something I didn't even I said I was going to touch on this, and this is a little bit more complex, and you have to be set up a certain way. But I'm no longer scared of the income variability because I figured out how to control that. You can use investment vehicles like in retirement plans to bring down your uh, your taxable income. When you are working for yourself, I'd highly recommend, like, if you're really taking off. Right now, I'm an S corp, which is a taxable. It's a tax status. I'm an LLC, tax as an S corp, which means that I pay myself a salary. There's less, and do I even want to go here? I have some other videos on my channel that kind of talk about this, like the benefits of a S corp election. But one of them, and I cover how this works too with controlling your insurance costs. Long story short, basically, you can, instead of just paying yourself and filling up your personal account with lots of money and then spending out of there for your health insurance plan, even my business pays for my health insurance premiums. So that's less income that hits my personal account that I get taxed on, that's all pre-tax. So paying for health insurance, that's pre-tax. I can take pre-tax retirement contributions. Um, and that's one of the main vehicles that I can use. Like, okay, if I see that I am about to like exceed this income level where I'll be eligible for a tax credit, I don't need all the money in the world to take care of myself and my family. Really, what I would end up doing with any excess money would be putting in a retirement account anyway to save for the future. I can do that before I pay myself. I can do the business can put money directly into my retirement account, so it gets to me. I get to benefit from it, but I'm not taxed on it at all. So I can kind of determine what income level am I happy with that is enough to provide the quality of life for me and my family that we desire. We don't need to live lavishly. Uh, we don't need like crazy stacks of money decorating our front yard. Um, we can just save that and we can put it in tax advantaged uh, financial vehicles. I sound like a nerd now. Um, but using that as a way to keep our our income low. So even though my business could be making mad stacks of cash, I can still set a cap of how much I get paid as an individual and how much is going to show up on my tax return. But I still get income coming in to me and my family in my retirement account. There's even ways where it's like I could give it to my kids. There's things that people start kind of getting a little like wacky with, and really, if you feel like you're trying to cheat the system, people sniff that out. But anyways, check out. I have some other videos that kind of explain that a lot more succinctly than what I'm trying to spin up off the top of my head right now. So check that out. And yeah, thanks for coming in and hanging out. If you have any more questions, drop a comment. You can reach out to me at selfemploymentsidekick.com. You can book a pick my brain session, pay what you want, and hop on a phone call with me, and you can ask some more questions for a few minutes. But I hope this was helpful. It was a little scatterbrained. I'm not a live streamer doing this off the top of my head. Like I really didn't have this super well prepared, if I'm being super honest with you. But with the enrollment period coming up in just a few days, I wanted to get something out there to point you in the right direction and let you know that you don't need to be scared of health insurance, and you don't need to feel like you're alone in all of this. I'm happy to come alongside you as your self-employment sidekick and just give you any insurance assurance, encouragement, and help that I'm able to provide you, because I think what you're doing is awesome. If you're trying to start a business, take care of your family, that's really awesome, and don't want things to get in the way that don't need to get in the way, like health insurance and other things that might confuse you, that I've been able to figure out, and I can share some insight and help you get over that hurdle. If this was helpful, please subscribe, like this, share this with a friend who might be going through a similar situation, and follow along as I'm gonna drop some more awesome knowledge on your amazing brains. Thanks for watching. I don't know what we're doing here. That's not the best sign off ever. But Merry Christmas, all. Wish you all the success, and wrap up this year uh, well. Enjoy your family, and here's here's a looking. I'm getting tired. I need to eat some lunch. Bye. I'll see you in the next one. End stream.